It is known as the silent killer, but there are subtle symptoms that go along with ovarian cancer that women need to know about. WDSU anchor Randy Russo went on call to find out about them.
September is Ovarian Cancer Awareness Month. This type of cancer is one of the most deadly for women. Each year, more than 21,000 women will be diagnosed with ovarian cancer. So we are tapping into our own call network on how you can stay healthy. So joining us to tell us more is Dr. Scott Nicholson-Uhl, an obstetrician gynecologist with West Jefferson Medical Center. So Dr. Uhl, first of all, what are the signs and symptoms of ovarian cancer?
Well, unfortunately, there's not many signs in the early stages, but in the later stages of ovarian cancer, patients would typically complain of either abdominal or pelvic pain, maybe nausea, and even urinary frequency if the tumor is actually pressing on their bladder.
So how do you screen for ovarian cancer?
And that's another unfortunate thing. There's actually no standard screening test available as there is for breast cancer and cervical cancer. So the best way is to get your annual exam done every year with a gynecologist, and if he or she feels anything that feels unusual, they can then do a transvaginal ultrasound to evaluate the ovaries and then do further evaluation if needed. There's a test called a CA-125, but it's not truly a screening test, and there are actually studies being done on that blood test to see whether or not the combination of that ultrasound and that screening CA-125 would be valuable, but as of right now there is no screening test.
And we do know this cancer is deadly, but what are some of the risk factors of ovarian cancer?
Well, probably the biggest risk factor is just hereditary. There is a gene mutation that has been identified that puts women at more increased risk, but even if that mutation is not present, a family history of ovarian cancer will increase your risk, and having a personal history of breast cancer will also increase your risk. Age alone is the biggest factor probably because it seems to strike more women in their menopausal years. 5% of women who live to be in their 70s will be struck by ovarian cancer. Not having any children does increase your risk as well, and obesity can increase your risk as well for ovarian cancer.
Some great information, Doctor. Thank you so much for joining us on call. And you at home can watch more of our on-call segments online anytime on WDSU.com.